Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, we're joined by Dr. Shane Black, who's a technology consultant and academic with over 30 years of experience in IT. We're joined by Associate Professor Amina Tariq, an Associate Professor in Digital Health within the School of Public Health and Social Work at QUT, and Professor Stephen McPhail, an internationally renowned health systems innovator, health services researcher, health economist and clinician. Team, how are we going?
Really well.
It's great to have you on the podcast today, and we're talking about bursting that bubble of good old artificial intelligence in healthcare, because there's a lot of hype and interest and conversation about it, but bringing the bright minds of digital health into this conversation to kind of unpack it a little bit more today. But maybe for those unfamiliar, it'd be great just to get to learn a little bit more about yourselves and the work you do, and I guess your experience around healthcare and artificial intelligence, and we can kind of dive into a bit more. Shane, I might start with you. Tell us a bit about you and what you do.
I am a technologist. I have been working in the industry for almost 35 years now. I started in the late 80s, and I've been fortunate enough to work in pretty much every discipline of IT, from software development through to design, implementation, user support. And I've also led IT departments and worked with executive teams to develop strategies. But I think that the underlying sort of foundation of my career has always been focused on digital transformation. But in recent years, I've been focused on AI and working with AI tools, and also research and doing some work with AusHSI and Steve's team.
Excellent. Thanks, Shane. What about yourself, Amina?
Hi, Pete. Thanks. I'm Amina, part of the AusHSI team here at QUT, and I'm Associate Professor, as you mentioned, in Digital Health. No surprises, I come from a software engineering background who shifted to health. So when people hear me working in School of Public Health and Social Work, they usually assume I come from a very clinical or a public health background, but I'm a trained software engineer. And the reason I shifted to health is that I was very interested in things that are complex. And I think there's nothing more complex in the world more than delivery of healthcare. So that's the interesting part. And the dimension that I focus on is more the human factor side of things. Since my training as software engineer, I realized that design and how humans use technology is the core. How we use these things actually matters the most to make them work. And my entire research for last 2 decades has focused on how we can use technology better in healthcare, be it for safety, usability, quality of outcomes. And I work through broad spectrum of technologies. But obviously, in the last 5 years, the boom that we have seen with AI, my work has more shifted towards looking at efficacy of clinical decision support systems, which use these AI algorithms largely. But as I said, my focus is on the human side, how humans adopt and use technology, and how can actually healthcare make these technologies work better for their workflows.
Love it. It's great to have you on the show again, by the way, Amina. And lastly, Stephen, what about yourself?
Nice to be chatting with you, Pete. We've sort of heard from these two about how there's many different sort of backgrounds that come together. I'm probably a bit similar. I started out life in a clinical context as a clinician, then sort of transferred into organisation development sort of roles to try and improve systems and services. Got involved with large-scale digital implementation. In there somewhere, I also became a health economist, that's probably a lot of work I do is at that intersection of digital health and AI, and that intersection of implementing that in real world settings, and health economics alongside that to make sure we sustain it and don't just become a nation of serial piloters where we just do one small thing after another. So I enjoy working at that intersection of implementation, health economics, and digital health and AI.
Yeah, love it. Look, it's great to have everyone's experience in this conversation as we kind of look at one of the trendiest kind of technologies to hit the shores, so to speak, in the last couple of years. By the way, for those listening on audio or unfamiliar, when we refer to AusHSI in this conversation, it's the acronym of the Australian Centre of Health Services Innovation. And you can check the details in the show notes of this episode. So if I was to look back and think about everyone's a lot of people have experience with AI tools and they're exciting and there's application and there's all this potential that exists. There's money being thrown at it, and there's I guess health systems maybe contemplating the utilization or the let's not utilize these tools. There's just a lot of hype is the overused term, but it's kind of the excitement that we've got today. And anything that has an industry trend often is referred to as a bubble. When's this bubble going to burst? Are we going to go up on this little bit of a curve? I'd love to get each of your takes on, and maybe we start back with Shane on with this bubble of AI in healthcare. If we're reaching the peak of it, what does that mean for innovation and implementation? I guess the real world application of this kind of stuff in healthcare to you.
Look, having worked in the industry for such a long time, I guess I've lived through pretty much every major technology bubble, from the PC revolution and the paperless office, the big data and data warehousing boom, the ERP and enterprise software religion of the 2000s, the dot-com crash. And they all had the same sorts of patterns where there's this sort of period of excitement. And then everyone's sort of clamoring to use the technology without really understanding it and implementing it in these complex systems, and the human factors that are associated with it has a real impact on whether the implementation is successful, whether the technology is useful. So I guess for me, the bubble, and it's not bursting. What I'd say is, that's a little bit dramatic. What tends to happen is that it happens in waves, and we start to learn how to manage these technologies as we learn more about them. So I guess the underlying thing is building our capability and our understanding. And I think once we start doing that, then we can start to think about that normalization. So you've got the overpromise and the under-delivery, and then the normalization, where we start to use these technologies. And I think that's where we're going to get to. Again, it'll still be waves, but we'll get there.
Yeah, Amina, I think about, like a lot of when there's a new thing that comes out and on the surface you look at it and go, wow, this could do X, Y, Z. And those expectations are really high. And I guess the more we kind of dig into it and utilize and test, tools, there might be frustration, or there might be confusion, or just, I guess, not even time to kind of play with is probably the wrong term, but to really come to terms with it. But what's your kind of take on where we're at with this, I don't know, adoption curve or the bubble, or however we want to refer to it?
Thanks, Pete. Yeah, I completely agree with Shane that things happen in waves, and you are completely right. With users, that's how we feel. Like something new comes up, like GPT games, and everything was solved for every human beings on the planet. And suddenly we realize that, oh my God, it hallucinates so much. It's making up stuff. It's not, thinking about it properly. And the short answers are not the right answers we want. And then all that research that is now coming out telling us the things that we need to be cautious about in its usage. It's the same with health. I think the philosophy that happens with technology as a software engineer, we are taught to be innovative. Go out there, take the risks. If the code doesn't work, nothing will go wrong in the world. You can make new code. And that's how I was trained. In health, we are completely different. So, from the day one, because it's a matter of life and death, you need to be very cautious. So when I see that, technology is designed in a way to take that risk, whereas in health, we have to be cautious, those two sort of paradigms when collide, that's where the, shift is happening, that we need to be taking risks with technology and how we adopt, especially the bigger things that AI is making us possible, which human mind cannot. But we have to make sure it's safe. We have to make sure it's usable. We have to make sure it's fit. And that's where I completely agree with Shane that all the transformations, actually, if you look at basic transformations like ERPs and in healthcare, for example, electronic health records, they were supposed to revolutionize. We still in 2025 are struggling for their adoption and how they're used, and they're not usable. So I think where we will see AI really helping us is actually overcoming some limitations of those technology paradigms, because they've unfortunately underdelivered, and the promises of big user experience and, using data good for everything, they may help us, but we are still in that shift in healthcare, we are still trying to understand what AI has to best offer us, where it can be safely used, which type of algorithms work, which not. And if we look back at the computer scientists who publish like 100 papers a day, maybe they can actually tell us that, look, there are so many algorithms, so many possibilities, but their real world implementation and really alignment with clinical workflows, that's the big leap that this bubble really needs to take if it needs to mature at a level where it needs to normalize, like Shane mentioned. But obviously, Steve at the economics end of things will have a lot more to say about sustainability and how these models work.
Oh, yeah. I mean, I think sustainability is definitely a huge issue at the moment, right? I alluded to it at the start, but we are at risk of becoming serial piloters. And I think it's not just the economics side of it that's letting us down at the moment. It's actually the underinvestment in the implementation to start with. And we've got to stop thinking about implementing AI as implementing a technology in the context of healthcare. It's actually a lot of change in workflows. There's going to need to be a broad stakeholder group that are in the circle around planning, but then also when it comes to implementing and rolling out. And so before we get to the downstream sustainment of the health economics side, which I think is really important, we actually need to get the investment right up front to ensure we're not just investing in a license for, an AI technology, but are we actually are we validating the vendor claims before we figure out if this is right for us? Are we piloting and evaluating it in a way that tells us what works, what doesn't, what we need to change? And then as we move forward into becoming business as usual, is it really having the effect that we want? And have we planned for that from the start? And if not, well, what can we do about it? I think at the moment, every AI implementation in the context of real-world healthcare at the moment is almost like an experiment. And that's what we actually need is a whole ecosystem. We need a whole ecosystem that's learning from one another, and where we are taking those lessons that are being learned by AI implementation failures, of which there are many, but often they're undocumented, and often they are not in a public sort of sphere for discussion. And so we need to learn from those things, bring them forward, and so that others can benefit from those lessons. Then we also need to think about how do we pay for it, because when we're bringing in the technology and we're investing up front, we've got to see that return on investment. But we're in a situation, I think, in healthcare where we're not going to have the workforce to cover the demand in the future in the same way that we do now, and we're going to have to find efficiencies. Now, these efficiencies, are not necessarily all about automation. There's probably some back office things that could be automated that are probably not frontline. But to have a capable human in the loop for the clinical application, that's actually critical, of course. And so having that augmentation rather than full automation is where that discussion needs to happen. How we go about that at scale and in a sustainable way, that's the conversations we should be having.
I want to come back to those, structural or cultural shifts that we need to make and what those look like. I love that's why Talking HealthTech exists. Share some of those stories and, learn in public almost where you can. And hopefully as an ecosystem, we can all kind of, improve by those 1% that have that transformation. I reflect though, on and maybe back to Shane, but also anyone that wants to weigh in. I guess I think about the general sentiment overall, artificial intelligence, outside of healthcare. If you think about very large organizations, there's often this sentiment now as from an employee on the, maybe the frontline employee's perspective is, at an executive level or at the board level, they're pushing down these AI tools at us and really forcing us to utilize them because, and there's it's going to do our jobs. And maybe at an executive or a board level, it's like, we can do things more efficiently with less people. I don't hear those conversations in healthcare, to Stephen's point also, but that, we don't have enough of the professionals in order to deliver healthcare services. So we need to be able to deliver more. And there are also a lot of clinicians and there's a lot more of this, I guess, call it shadow IT, of utilization of AI tools from the bottom up, just because they're solving a problem. And to Shane's point earlier, there's a lot of different technologies that have been different waves and different trends and everything of and new innovations in technology. And often in the past, healthcare has kind of been seen as this laggard that doesn't kind of adopt technologies. And my argument to that is, well, often because those technologies didn't really solve a particular problem, or it wasn't clear what that problem was that it was solving. And now this AI piece is that. So what's your kind of take on and maybe that's just the nature of broad brushing this concept of artificial intelligence, is that it all depends. But, this sentiment piece of AI specifically in healthcare, is it different to other industries, Shane, or is it, there's similarities across all the board?
A lot of similarities. I think it's because healthcare is maturing digitally, and I think that was accelerated during COVID with the telehealth and all of these technologies that had to be adopted because of the way that they were delivering care. So I think they're more open to technology, and AI is different. So when you look at the previous waves of innovation, the focus has always been on automating processes. And healthcare, the culture's fairly sort of strong in terms of how they stick to what's tried and true. And so they are a little bit more resistant to it. The difference with AI as a new innovation wave is that it's the first technology that actually automates thinking, which has a major impact on our identity as decision makers. And therefore, it can come in and supplement our decision making in a way that was not available with any of these other technologies. So I think that they're more open to it. And the fact that every man and his dog is using ChatGPT for things like summarizing notes or drafting emails means that the clinicians are being exposed to this technology. But the problem we have is that, this is getting back to the pilots, and I'm a big supporter of pilots because I'm showing people shiny things and they get excited about the shiny things, and that contributes to the hype. The way that I look at it is that you have to build capability. You have to educate the leadership teams and not allow them to make decisions on technologies based on a vendor brochure. It has to be informed. They have to know what the technology can do and what it can't do. And with AI, there are a lot of things it can't do, but that's glossed over because it's this magic thing that does all these beautiful sort of images and creates little TikTok videos and helps with decision making. So I think we need to start educating and building knowledge about how we use those technologies.
Yeah, I couldn't agree more with Shane. I think my 20 years of research tells that a lot of technologies are designed based on work as imagined. Software designers sit in their room, make those boxes and beautiful arrows and tell, oh, that's the perfect workflow. We can easily implement it. And executives, to be honest, work with those work processes. So they know, that's, broadly what's work. But then when the technology is implemented, we realize that the process that was defined to be, working with that technology was actually not that way at all. But one thing that I would like to highlight is that, you said, yes, healthcare has always been called laggard. They're very cautious. If things don't work, like if the perfect workflow is working, why would they take up a technology that really disrupts the workflow or that, is unsafe in any way or form? That's usually the way. But they're actually very good in adopting technologies that make their work painless. For example, I don't think too many people know, but AI scribes have been taken up by healthcare workers because a little bit desperate because of the over-documentation required from them. So we have seen that some healthcare organizations, we have worked with one of the largest allied healthcare provider here in Queensland, and they have taken and adopted AI scribe solution. And the good thing is that they're really working it through, like what works, what doesn't work, how can they make it work better. And the interesting thing they did is, why do we use AI? Because we think it learns and improves. They didn't switch on the learning capability in the first year. They actually kept it switched off just to see how they can work, and are their clinicians working with it well? Is it really helping? And because of, all the adoption of ChatGPT and other common tools, now public is very well aware of these tools. So when they ask their patients how the experience was, most of the patients agreed that they were very comfortable with usage of these, AI tools. So we have seen this public awareness really helping clinicians to get the confidence as well that, we are comfortable in using these technologies. And that's where we see that, yes, healthcare can be laggard and resistant, but it can be very, proactive in adopting those technologies that they really think will help and reduce that administrative burden, as Steve highlighted earlier, that they really want AI to solve the real problems they have, not the imaginary problems that a designer may think in their head. That's the difference I have seen in my 20 years of sort of, working through technology, that finally we're seeing like healthcare being, no, we are ready for this. Let's try it out.
Yeah. Well, look, I mean, healthcare does need that confidence in order to be able to utilize things at scale, and often the tool that we utilize to build that confidence is, the tool of governance and placing structures around things, and often people might look at the process of implementing governance or over engineering something as the stifling innovation. And actually, I was talking to someone a couple of weeks ago. Actually, they were at an early stage startup, and they're like, one thing that they thought was advantageous to them was that they've got at their flexibility this, everyone talks about how a startup can be much more agile and move faster than a big enterprise. But the specific example was, the big enterprise that they're competing with has turned off a lot of, they've got all these, rules against utilizing artificial intelligence tools in the way they build things internally and do things. And I'm sure there's good reason to that. But versus the startup that can then fire up agents, and I guess if they can use it appropriately, then the theory is that they can kind of do things much faster. So there's a risk, I guess, of enterprises in trying to pad themselves with a lot of kind of governance around things that then perhaps slows them down to the point that they're no longer competitive. But I'd love your take, Stephen, on how do we kind of find that middle ground between, we obviously need to do things in a safe and measured way, and governance is the way to do that, and how do we make sure it's that isn't a barrier to being, able to scalably launch an AI solution innovation in healthcare?
Yeah, good question, Peter. I mean, it sounds like the most boring question in the world. How do we do governance better?
I tried to make it funky, though.
You did a great job of that. It's actually one of the most interesting and exciting questions, right? Because, just like, traveling became a lot better when we had paved roads, there's no reason why governance can't actually be our secret sauce to being responsive and agile and safe at the same time. And that's actually where the challenge is. It's not necessarily that being safe is a problem for slowing things down. Actually, being safe is, we have to be safe. How fast we go is a different question. And so sometimes people get confused, I think, between what is safety and not safe versus speed. And so that they're different sort of slightly different paradigms. So yes, in healthcare, we have excellent systems of governance to keep patients and community safe, and we need to have them. That's not negotiable. You're very, very right in that they often are slow in putting handbrakes on things because our existing paradigms around ensuring there's clinical trial evidence and multiple review systems before we end up implementing new things, that maybe is not quite the right paradigm in the context of some of the things we're talking about, particularly if we're not talking about automation but augmentation, where we've got a capable human, a health professional in the loop. Yes, we absolutely still need to make sure that we are doing all the safety checks, and that's pilots are obviously good for that. But there can be systems and processes that we can set up in even very large healthcare organizations where we have landing pads to test stuff quickly and with agility. We can have a workforce that is capable of doing the necessary checks on a technical front and on the human workflows side with some level of responsiveness and speed. It doesn't have to take that long. But what it does take is us to organise ourselves within organisations, healthcare organisations, in ways that we have adapted the existing governance systems to be suitable for the new technologies coming in, whether it's AI or anything else for that matter. But AI is obviously the one that's front of mind at the moment. I think at the moment we are using governance structures that we don't want to throw out. We don't want to take on a whole new stream of governance structure for an AI technology coming in, and then just add to the governance burden. That's not going to be helpful. We need to have that proper integration or adaptation so that we can do responsive governance that is fit for purpose for the level of risk that's actually associated with technology coming in. And AI scribes is an interesting outlier, right? So that's just taken off in the last 4 years or so. And we've seen that now to the point where we have recruitment problems for healthcare organisations in some disciplines where they say, well, you haven't got an AI scribe, I don't want to work there. So it's not going to be a case of this is a luxury. It's going to be a case of we need to be doing it if we want to have a workforce that is the sort of workforce that we want. But that does, just to get back to I don't put my health economist hat on too often, but as a health economist, if we're using volume-based licensing then for technologies, then we need to make sure they're delivering. And that's why I think that risk level is important when we do governance, because some things are low risk, some things are not low risk, life and death even. And so they're not going to need the same level of governance sort of hoops to jump through, but it's also got to align on the financial side in terms of the return for the community through our health services.
I mean, that's a great point around the utilization of an AI scribe is almost, I guess, more than a perk of of employment or being engaged by a clinic. Because I think about this a lot too, and would love Shane's take or anyone on it as well. There's going to be a point in which, because I don't think that we're going to turn off. We're going through this process of like pontificating about AI in healthcare. It's not going to get to a stage where we go, you know what, let's turn off the AI. It wasn't the right call. There's probably another solution here. I feel like we're well down that path now. And my theory is they'll get to a point where it will no longer be, they'll get to a point where it's not safe to, the safest solution is to utilize AI tool, so that because the humans can't do it fast enough, it's accurate to a point in which it's in the same way that we use tools and the internet and other kind of core infrastructure in clinics. It would not be responsible of you to not use electricity in your clinic because it's all just there and it's reliable, and it's probably a bad example. But then at what point does that mean then we're are we focusing on the right things to talk about here? Because often the discussion in healthcare is like, oh, should we be utilizing this or should we not? Is this the right decision or not? At what point do we go, you know what? We're on this train now, so let's kind of lean into it. And what are then those things we should be doing as an ecosystem so that we're actually, trying to actually solve a problem as opposed to just arguing about it?
I think governance is front and centre. But it has to be the right type of governance, as Steve alluded to, in terms of you've got the various risk levels and you've got the different technologies, and AI is evolving so quickly. And you've got the different approaches to applying governance. These governance frameworks that are sort of top down and they're policy heavy and they have lots of regulations, but it's a one size fits all. So you have to try and work your technology into that framework. And then you've got the other end of the spectrum, and you're talking about these startups where it's market driven, where they just let the AI evolve and then the governance has to catch up. So you've got that sort of that broad spectrum. And then within that, you've got, these sort of diagnostic AIs that are embedded in clinical decision support systems that, impact on patient outcomes. And then at the other end of the spectrum, you've got those general purpose AIs for, your emails and for summarizing your notes. So we need to think about how do we build adaptive, multi-tiered governance frameworks that's able to be customized and contextualized to the technology and the level of complexity of the technology and the context of the implementation. That way, you start to get that safety, but you also have controls. So I think that's the first step. And that comes with building capability and also readiness. Because if they're not ready to adopt the governance, then it doesn't matter how well you designed it, they're not going to use it. And we need to start thinking about how do we build that capability and how do we increase that readiness.
I think there's something in, building on that, this idea of flexibility and choice and all of this too. Like I'm thinking of random examples today, but I'm looking down at my fancy new iPhone 17, right? And as I'm using all of because I had an older 14 without all the fancy Siri AI stuff. And so I'm like, oh, cool, I'll turn on the AI summarization of emails in the little thing there, and that's going to streamline my whatever time that I have. And I see the summaries and I'm like, I don't know whether I should believe what this like 2-sentence can I just like have the normal email, like, because then I can interpret it myself. And then so I've turned off a lot of it because I'm like, I get that it's cool, but it's like that's not helping me. And so but maybe someone who's first utilizing a phone really wants the AI summary. I don't work well with an assistant generally, so maybe I just need to know it firsthand and the real information. And I can see that coming through in healthcare and in any industry, actually, in terms of these tools. So yes, it's cool and yes, it's clever, but then I guess it's where we point that cleverness. But then also maybe some parts and people will get a lot of benefit from it. Others, just have a job to do. But yeah, I'm not sure where I was going with that thought, but I feel like that was something valuable in it.
And look, and it comes back to capability because, it's bad if the AI model makes a mistake. It's even worse if the human misses that mistake. So we have to build that capability. I mean, you talk about it summarizing your emails and your notes, but this is based on the assumptions that the large language model makes, not what you're looking for. So, again, that's you knowing what to look for. That's you critically thinking about, okay, this is what I want it to do. These are the things that I'm looking for, and then being able to tell the technology to actually do that. And people don't do that. They just treat it like a chatbot. They just sort of ask it a question and it gives them an answer. They go, sure. That's where it's automating the thinking. And we've got to get away from that.
Yeah, towards the augmentation. Is the key,
yes,
right?
that's it.
It can help give you the information you need, but it's got to be. And trust, you alluded to trust as well. Trust is so critical in this. I know there's been a lot said about trust and AI, but just, a quick anecdote from a conversation I had with a colleague yesterday. Was around a failed trial of, I won't name the technology, but it was an AI technology in the field of radiology. And the key issue was that it was right about 95% of the time, which if you're trying to, it's actually pretty impressive from a technology viewpoint to interpret that sort of complex imaging right 95% of the time. But if you're getting 1 in 20 wrong, and that's a life and death situation, the clinician is not going to try, and that's sort of what that technology was for. So in the end, they decided not to pursue it further because at this stage in their context, there was a risk that if we turn it on, we will start to trust it, and then we will start to miss things, and that's a real challenge. So it was a very wise decision, I think, at this stage. Now, I'm sure that technology will continue to improve and maybe there'll be a future iteration or whatever. But for the moment, without that trust, even if it can do it well most of the time, that opens the door to the missing that 1 in 20 where it matters and it's wrong. And so I think that's where we're at the moment. I feel like there's and this is probably reflected in a lot of areas of AI, but we do have a mix at the moment in our health community where we've got a bunch of people who are new adopters of large language models to summarize their emails and they're excited about everything, through to people like Shane who understand how things have worked for a number of years and seen things come and go in different ways and progress forward. Depending where you are on that experience level may actually impact on we started the conversation talking about are we in a hype sort of bubble with this? And I think that, the over-promising and the under-realization and under-delivery is that associated with that bubble, but we could actually just, some of us could be in a trough of disillusionment, sort of, to use the situation where we are, referring to your wave analogy, Shane, at the start, so I think at the moment we just have people at all different levels. Some are still, thinking this can solve every single problem that we'll ever encounter. Some are thinking this is not living up to my expectations. But the reality is we will get to a point where we're finding what's good for what and how to do it well. And so I'm really optimistic and bullish that we're going to get to a good place. But some of those key issues that we need to sort out, like governance, making sure things are trustworthy, making sure that there's a return on investment. If you're investing in AI scribes thinking that you're going to save time, does it actually save time? That's a good question to ask. Perhaps it's not actually about saving time. Perhaps it's about having a conversation between the health professional and the patient without looking at the screen and typing notes. Maybe that's actually the value proposition, is in improving the way we do it, not necessarily just the time. So I think we're going to figure those things out, and I'm optimistic we're heading in the right direction with that.
I agree with you, and there's a lot around that cognitive load piece, given the heavy cognitive requirement of healthcare generally, be it clinical or not clinical, wherever you're working in healthcare, to do some of that heavy lifting or low acuity tasks, however we want to refer to them as, there's opportunity there. As we start to round out the conversation a little bit, I think we've touched on a few times this need for, workforce readiness, and Stephen even kind of, touched on that there. Everyone's at a different kind of stage and sentiment when it comes to AI. Are there things that you would hope that the ecosystem does, or even someone who's just working in healthcare, who wants to increase their education or the readiness for some of these tools? Amina, I might start with you. Is there any thoughts around how we do this more meaningful workforce readiness and what that looks like in this age of AI?
Thanks, Pete. I think as one of the academics who have designed a course at QUT saying that, this will make you digital health ready. One of the things that we have realized, especially since COVID, is that it's not about, making technology scale or having digital health basics as an, isolated skill set. It needs to be embedded in our clinical education. It needs to be a core skill set. And it's not about, making our healthcare professional programmers. And by the way, that's our tagline. You don't need to be a programmer. But it's more about how to engage with these technologies and really participate in the, that process of design effectively, because, it's going to be your work. So it's very important that you play an important part in the design and have that baseline understanding of how technology can be effectively used. So now I think we have shifted in more sort of tertiary education from this mindset that we need isolated courses or, this AI in healthcare course that you can go online and do in 4 weeks, to more like embedding technology conversation as part of, basic. For example, I was just chatting yesterday to one of my colleagues who teaches anatomy, and we were talking about different ways in which he can have a conversation about, digital health and different pieces of digital health in that. Physiology, very basic medical coding that we teach to our graduates here at QUT. Again, it's not the conversation that you need to have separately or have we need to teach you about databases. It's about how to effectively use data, effectively engage with these technologies. And the most latest interesting conversation I've had with our School of Physiology and Exercise, which is trying to make sure, again, using AI scribes as part of the training that our placement students get. So it does not need to be a specialized piece, but that's more readiness of the workforce that's coming. When healthcare professionals themselves lead that process of design and evaluating, the outcomes will be much better in terms of adoption, sustainability, and really sort of, channeling the workforce and taking them along, that this is how you use them. One of the things that I just want to add to this conversation is that we have to think of AI a little bit differently, because this system is going to feed into many other systems. For example, we have just proposed a project where we are telling that, all the knowledge that's coming now through these AI scribes need to be fed into a clinical decision support system. We looked specifically at the problem of, back pain recommendation, which is a very tricky, complex problem. And it's not an easy solution. There's no sort of, one straight answer to how. It's not a pill that you give to the patient. So it's a complex thing. And how can we use all that data? That puts a lot of different things and pieces in conversation. How can these systems be feeding into other systems, leading to different clinical outcomes? What is the governance process of that? What is the adoption process of that? And if somebody decides not to use it, what it will look like, because they're really not contributing to that data set. So I think that's where we really need to make our workforce ready on the same page, because if we don't do that, the gaps will become wider. So, our organizations that using the same systems may look at things very differently in terms of dealing with a problem. One thing that I think especially is happening more on the education side, it does changes roles. It does changes the requirement of the skill set they have. For example, doing clinical coding is very different using AI tools than, when you use very manual system. So the challenge is also preparing everybody for that change. And as somebody who has just changed from iPhone 14 to 17, I think, we don't cope with change one day. I did the same, by the way, so I can easily relate to you. It's even if the change is good, even if we know we did it for the better. And I think those core basic things as human usability, we need to know about, and we need to do the same for AI. Otherwise, our outcomes will be the same. We changed the weather website, the whole country freaked out. Rightly so. I agree. We should have done enough usability testing. So AI got excited. Everybody, those wonderful weather maps. We didn't do basic usability testing on the thing to see if people can understand the information. So I think beyond the hype and beyond the excitement, remember the basics of technology. Make sure thing is working. Make sure that people are able to use it. Because when we get overexcited and switch on everything, we know sometimes we are overwhelmed and not able to cope with change.
Spot on, and it's so important about that bigger picture too, Amina. And I'm glad I'm not alone with some of those thoughts too. So, but Shane, your take on bringing those humans along, and any other thoughts that come to mind, following on from Amina about as we continue to evolve to this AI world.
I think we need to start tying everything together. I mean, we talked about how, and Steve talked about different levels of knowledge. Amina talks about how clinicians become engaged in the co-design, establish a better understanding of the technologies. So I guess if we've got this sort of flexible, adaptable governance framework that's contextualized to whatever the implementation is, and we make competency and capability and building that capability a function of that framework, then we start to see that it is not just purely training that we're giving people. We're lifting them to a certain level of understanding. And that's the literacy side of it. And then you're using education to build on that and allow them to provide feedback on these tools so that we can improve them. So I think we're sort of getting there. And it's part of that normalisation process. And I think the sooner that health organisations can recognise that governance is not a handbrake, it's a steering wheel. And I look at the technology is the car, the capability is the driver, and the readiness is the road. And that's how we sort of navigate that complexity, by adopting that sort of analogy.
One thing, Shane, just as you were talking and as Amina was talking before, just reminded me to think through what we mean by workforce too, because we often are thinking about bringing up a certain level of capability. Our clinical workforce are remarkably capable in each of their domains. And we also have within healthcare systems all sorts of technologists, and I won't name them all, but for different levels of I guess, skill and technology implementation experience. We're going to need to think about, are our proportions right in some of those areas of the system? Do we actually need a few more people in a different area if we're going to be relying more on technology? That's not to say we need any less clinicians, but if we can overall, what we actually need is really, to lift productivity without losing quality. In fact, if we want to lift productivity and we want to increase quality of care. And so that there's a training component, there is the elements of governance, and as part of that, we need to think about, is our workforce actually the composition of the workforce right. And there's, of course, flow-on effects for how we resource that. But but I think that's some really good points there.
Well, look, I think we've covered off, those fundamentals that we need in order to navigate through these exciting times, and also some bigger picture things to really make the most of, the direction we're going. So we'll make sure the details for AusHSI in the show notes of this episode for people to check out and learn more, and see the listing on our website, and heaps more content too. So Amina, Steve, and Shane, I really appreciate making the time. Thank you so much.
Thank you.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.